Hi, everybody. I'm Robin Puglia, and this is something that has come up several times, both in my clinical practice and in my um, clinical consults and professional mentoring in the last month. And so, since it's been a conversation I've been having, I thought that I would take a minute to record a video and share it with you in case it is relevant or helpful for you. And that is how to understand and read Epstein Barr virus antibody test results to understand what we're looking at. Is it reactivation? Is it a historical exposure? Is it recent exposure? What are we actually talking about here? So let us dive in. So when we're talking about Epstein Barr virus antibodies, um, a comprehensive panel will have three different antigens that they're looking at. They will have viral capsid antigen, or VCA. They will have nuclear antigen, which is sometimes referenced as EBNA, Epstein-Barr nuclear antigen, and they will have early antigen, EBV early antigen. So viral capsid antigen is the protein that is found in the wall around the DNA in Epstein-Barr virus. The nuclear antigen is the protein, the antigen from the genetic material of the virus. And then early antigen is a protein that is helping us understand reactivation specifically. So then within those three antigens, or those three markers of Epstein-Barr virus, there are two different antibodies that we're looking at. So we're looking at IgG and IgM. So the most comprehensive EBV antibody panel will have 5 markers on it. It will have VCA IgG, VCA IgM, early antigen, so EBV EA, and then EBV or EBNA IgG and EBNA IgM. And so VCA IgG elevates with the first infection, and then it stays elevated for the rest of your life. So 92 to 95% of the population have got Epstein-Barr virus, have been infected with Epstein-Barr virus. And so 92 to 95% of the population will have VCA IgG elevated in their serum. From this marker, you cannot tell how long it's been since infection, if it's recent, if it's historical. Just looking at that one marker, you don't know if it's reactivating. All it tells you is that this person has had exposure to EBV at some point in their life. So 50% of people are infected with EBV before the age of 5. And the other 50% are mostly infected as a teenager or in their early 20s. EBV is transmitted via saliva, and those are the 2 points in our life where we are exchanging saliva the most. So VCA, IgG just tells us that there has been exposure. VCA, IgM, on the other hand, elevates at the initial infection. So if you have VCA, IgM, and IgG, then this is likely to be first exposure, but it may also be reactivation. So VCA IgM can elevate with reactivation, but it doesn't always elevate with reactivation. So if it's present alongside VCA IgG, then that might be the initial infection, or it might be reactivation. However, if it is absent, that doesn't mean it's not reactivation, because it doesn't always reactivate. I mean, it doesn't always elevate with reactivation. Okay, then we have nuclear antigen or nuclear antibody. Nuclear antigen IgG elevates around 2 months after the initial infection, and it doesn't elevate for life. So if you see VCA IgG and VCA IgM, then we know that it has been at least 2 months since the initial infection, and it's probably in the first years since the infection, but it doesn't tell us, very specifically anything apart from that. If we see VCA IgG elevated and VCA, if we see VCA IgG elevated and nuclear antigen elevated, hang on, what am I trying to say here? And nuclear antigen not elevated, then it's likely been quite a long time since the initial infection, long enough for that nuclear antigen IgG to have gone back down again. So that gives us some idea of time frame if we have both of those antibodies present, but it's very non-specific. It's, years and years, as opposed to 4 weeks, 10 weeks, something like that. And then we have early antigen. So early antigen is the most accurate antibody that correlates with reactivation. So if we have got VCA IgM and early antigen IgG, this is a very strong indicator for EBV reactivation. But actually, that early antigen is really the one that I'm looking for that will tell me about reactivation. That's the one that will give me the most accurate understanding about whether or not this is a reactivation, yes or no. So a comprehensive antibody panel should contain those five full antibodies. So VCA IgG, VCA IgM, EBNA IgG, EBNA IgM, and early antigen IgG. And when we have all of that information and we can see the different patterns that come up, this is positive, that is negative, then it gives us the best shot at being able to kind of accurately gauge what is going on, how long it's been going on for, and whether or not we're dealing with initial infection, past infection, current problem, reactivation, yes or no. So just to use an example, this here we see the full panel. So we've got VCA IgG, VCA IgM, early antigen IgG, EBNA IgG, and EBNA IgM. And you can see that 2 of the markers are out of range. So this, for somebody who doesn't understand how to read the panel, having 2 markers out of range looks like this is an infection, right? It can be it looks positive. But in fact, what we see is the VCA IgG and the nuclear antigen IgG. So here is how I would interpret this. No early antigen, no IgMs. This is not a current problem. It is not initial infection. It is not reactivation, because I would expect to see the early antigen there. And it has been at least 2 months since the initial infection because we've got the nuclear antigen elevated, but it could have been years since the initial infection. Not long enough for the EBNA to go back down again, but we don't really have a time frame for that. So this is historical exposure. This person definitely has EBV, but it seems to be, based on this panel, well managed by the immune system, not reactivating, kept in check. This doesn't look like a driver of problems based just on this information. And so that would be my interpretation of this. Really what I'm looking for is this early antigen. So when you're choosing an antibody panel to understand Epstein Barr virus reactivation, you really want to make sure that this early antigen is on the panel, and this is the most comprehensive, where you see the 5 antigens. Now we have, I just wanted to give you a menu of some of the tools that you could be considering when you're thinking about understanding infection in your clinical practice. So 3 tools that you might have in your toolkit are Cyrex RA12, which is available from Regeneris Labs. Cyrex is an IgG antibody panel. It is not specifically an EBV panel, so it actually doesn't have any of these markers on it. It has something called citrulline EBV. It's very specific to autoimmune disease, and it is in fact a multi-pathogen panel. So it includes viruses, bacteria, yeasts, mold, and parasites. And it is the only panel that I know that has all of the different, or like a variety of different different types of infectious agent on it. So you should definitely have that in your toolkit. Then we've got the immunosciences antibody panels. Now they have a range of different viral panels available, including things that have COVID on, ones that are just looking at EBV, or more comprehensive viral panels looking at the herpes virus family. And then we also have Immunosciences is also available from Regeneris in the UK, and then we have Armin Labs viral panels, which are available from AONM, or the Academy of Nutritional Medicine. And they have also a range of different infection panels, and their viral panels include antibodies. You can just run the antibodies, but they also do ELISpot, which is a tool that we can use to look at latent versus lytic infection. And latent versus lytic is something that I'll discuss in another video another time. But there are more options available outside of this. You can get EBV and infection panels from the GP, available on the NHS, from other lab dispensaries as well. There are other options, but these are three that, if you have them in your toolkit and you understand them, will give you it's just a very solid place to be in clinical practice. Okay, I hope that was helpful and interesting. Let me know if you would like more of this kind of content.